Hi, this is Dr. Rosario from Andrus ENT and Sleep Center. Thank you for choosing us for your care. And the next few videos we're making is just to improve patient experience. We know that when you come in to see us, there's a lot going on. You have a lot of questions. We give you a lot of information. So this video is really that next step in hearing it again. And so you can go back on your own time and listen to what's being said on the video and then call us back with any other questions. So let's start off with the fun one, the first one, the tonsils. So we'll do tonsillectomy for patients where they're having recurring infections, and you actually need a lot of infections before we take your tonsils out. So generally we're expecting you to have 3 or 4 a year for several years, or more than 5 in a year, or you're having one episode of a tonsillitis that's lasting for 3 months or longer, or you're having a lot of episodes of strep tonsillitis and you're having some complications, whether it's rashes or joint pain or hopefully not any cardiac issues with it, but you're having a lot of infections, or you're having no issues for infections but more issues with obstruction or the size of the tonsils, where it affects how your face grows, it affects your sleeping, your restless sleeper. With kids, they're snoring, they're having issues for bruxism, where they're grinding their teeth, they're waking up tired, they're having attention issues during the daytime and behavior. So lots of obstructive symptoms, or even choking on foods, so are not growing well. So those would all be my tonsils are big. Some people will have infections, some people will have just big tonsil size, some will have both. So you don't need to have both. So we've decided that you needed your tonsils out for any of those above reasons, or maybe one that I didn't mention, but we've decided you need your tonsils out. What I want you to be prepared to experience is that for 2 weeks after, this is not fun. You may even hate me for a little bit, but you'll get over it because you'll see that the end was worth it, because we're only recommending surgery for people who really need it. So that first 2 weeks, day 1, you usually don't feel that much pain because you have the effects of the general anesthetic on board. But about day 3, that starts to wear off. But whenever you feel pain from a tonsil standpoint, know that it is generally fairly intense. And that can be your throat that's hurting, your tonsils and or adenoids refer pain to your ears, so they can hurt pretty well, and to your neck. So you might feel like you've got a stiff neck, and that it's maybe even hard to move. It's certainly hard to swallow. I would say the average kid loses 5 to 10 pounds in 2 weeks because they're not eating very much, and the average adult about 10 to 20 pounds in 2 weeks. I've only had one patient that gained weight because they ate ice cream the whole time. If you're nauseous, cut out the ice cream, more Jell-O, popsicles, softer food. So you can do pancakes, eggs, mac and cheese, just avoiding like a Dorito or something spicy. So the Dorito would be the sharp, something spicy, because all of those would irritate the back of the throat. If you look back at the back of your throat day 1, it'll look kind of pinkish black, and the black is from the cautery. As it heals, however, it gets to look white and cut. It's cheesy. It is not a yeast infection. It's okay. It's normal. If you have concern, take a picture of your mouth, send it to us. We can talk about it. Those white patches that you're seeing are the scabs that form from a cautery. So it's like the crusting you get on the outside of your skin if you ever have stitches or abrade yourself because you fell off your bike and scraped. So that hard brown stuff in your mouth looks white, so normal. Don't try to pick it off. You will actually swallow it with time as your throat heals. So during that whole time, from a pain standpoint, you will have pain medications that might be liquid or pills. You want to try to avoid taking ibuprofen unless otherwise directly recommended by me that it's okay to take ibuprofen. Ibuprofen for everyone increases the risk for bleeding. It, however, sometimes does better for pain than some of the other pain medications, so we'll sometimes say, okay, you can use some ibuprofen in addition to any other pain medications. Oftentimes there's also an antibiotic to help decrease the risk for secondary infection because the tonsils are in your mouth, dirty place. So after surgery, expect that you will have prescriptions for pain medication and for antibiotics. Oftentimes I'll also write for a throat lozenger, so it might be some viscous lidocaine that you gargle and then spit, trying to numb the throat. But you could also use a throat lozenger like something you'd use for a sore throat just in general. Anything like that helps to numb things for you. If you have any questions, please feel free to call us after hours. There's a queue that goes directly to my cell phone. Okay, hope this was helpful and just reminding you of our discussion in the office.